Assalamu alaikum wa rahmatullahi wa barakatuh. A very good day, good evening to you wherever you are across the lands and over the beautiful seas. If you're joining us via www.hilaal.tv, tell your friends, family and colleagues if they're not on the DSTV platform, that's where they can get us around the world. I'm Khawa Solomon. Shukran so much for joining us for another edition of your Health and Wellness Show. And yes, today's topic will be about men's health in this month of Movember. Yes, I said that right, Movember. We're changing November because it's Men's Month for a change. And we're talking about their conditions, what pitfalls they could possibly foresee in their health, their age, what's happening in their lifestyle today. We have specialist urologist in studio with us, Dr. Salim Janara. But before we get that conversation going, here's a message from the IMA president on men's health.
Assalamu alaikum wa rahmatullahi wa barakatuh. The Islamic Medical Association of South Africa fully supports the initiative of raising awareness of men's health and wellness during the month of November. Men, especially those younger than 50 years of age, are notoriously known for not taking good care of themselves and going for regular checkups. Yet, they have a high incidence of serious medical conditions. So this campaign of awareness is much warranted and welcomed by the healthcare fraternity. So when we speak of men's health, we generally think of prostate problems like prostatic cancer and benign prostatic hypertrophy and erectile dysfunctions. These are very important problems, but yet are very unreported due to various reasons. Yet the scope of men's health extends way beyond this. And I'd like to touch on 4 other medical issues that men have a high incidence of. Firstly, and most importantly, is cardiovascular diseases. These are hypertension, heart attacks, strokes, and heart failure. Men have a higher incidence of these than women, and it is a leading cause of death in the world for men. Secondly, are other metabolic diseases like gout, high cholesterol, and diabetes. Thirdly, are lung diseases like lung cancer, emphysema, chronic obstructive airways diseases, and occupational lung diseases like silicosis. These are related largely to the extent of smoking amongst men and the various occupations that they have. Lastly, but also very importantly, with the current economic challenges and issues with safety and security, more and more men are experiencing mental health issues, especially depression and anxiety, that needs to be properly recognized and managed. Therefore, we can see that it's important that men go for regular checkups so that we can prevent these chronic diseases or pick them up early so that they do not develop the severe, serious complications. In closing, I'd like to remind all of us that our bodies in good health are an amana entrusted to us by Allah subhanahu wa ta'ala. Without a good health and a sound mind, we will not be able to fulfill our obligations to our Creator, nor fulfill our obligations to our families and our communities. Jazakallah.
A big shukran so much to Dr. Irshad Musa from Cape Town providing us with that information. And do note that we are combining all and as much information as we can from the men that we have and we can tap on just to show you the importance of men's health. But now let's welcome our guest in studio, Dr. Salim Junara. Shukran so much. Assalamu alaikum to you, Doc.
Wa alaikum salam wa rahmatullah. Thanks for having me.
And recently you did a show on men's mental health. Very impressed with how Mo and yourself, tackled that topic, alhamdulillah, and definitely something to be replayed in our household. So men can actually take heed and know the importance of their mental health, alhamdulillah. So
Absolutely, thank you. It was a very well received show,
alhamdulillah.
and had good feedback on there. And hope that the information got out there.
Absolutely, absolutely. So, of course, if you've missed that, Motivation, he did an interview with Dr. Salim Junara on men's mental health. So catch that on our YouTube channel as well. Okay, so let's get this conversation going. Time flies when you're having fun. And I think the important aspects of looking at how men needs to take care of ourselves. And often as women, we nudge them and we pick something up and they were like, just blase, whatever. But let's quickly understand, as a urologist, a specialist, you see men all the time and you know their demeanor, the way they're handling themselves. And often it comes up, possibly not in emergency cases, but let's start from the beginning. What are the most common problems, men's health problems that could come up for men, and why do they get it?
Yeah. So by and large, what's unique about men is that they have a prostate. There's not something found in females. And I think by and large, if we look across the board, it's the conditions, I would say, primarily related to the prostate. And that can be sort of spread across the age groups. In younger individuals, they may have things like, infections, what we call prostatitis, or urinary tract infections. And then the older groups where they present with enlarged prostate and have issues urinating. Okay. So, often it's a very diverse array of symptoms. Patients may complain about having some issue urinating, delays getting started with urinating, frequency, maybe urgency, maybe waking up a bit at night, something a bit of burning. Yes. So it's like a whole constellation of symptoms. And by and large, that would prompt them to see their general practitioner or their urologist or their specialist, whoever they may see. And in that process, one would then go through a whole series of tests and checks. And like I said, I think if we had to, sort of summarize it, I think the prostate does kind of feature there. Okay. Well, commonly, I would say in males.
Not anything to do with the bladder.
Yeah. So because the prostate and the bladder are so close to each other, they often, we often talk about sort of two wide groups of symptoms. So what we call storage symptoms, and let's say irritative symptoms. Okay. So storage would now be particularly related to the bladder, your ability to hold urine, how long you can hold for, can you pull through the night with your bladder. Okay. And the irritative symptoms are more related to the actual passage of urine, So the discomfort with urinating, pain with urinating, burning with urinating. So the bladder and the prostate are like literally right next to each other. So it's very often that if it's a sort of a prostate issue, it's going to lead to some sort of bladder symptoms as well, There is an overlap between how patients will present, to a clinician. Yeah, so I think by and large, that's the lower urinary tract, Okay. So we can think about the upper and the lower urinary tract. Okay. Upper meaning the kidneys and the ureters or the pipes that connect to the bladder. And the lower tract would be, let's say, bladder, prostate, and the external genital area, or the urethra specifically. And then obviously the testicles in the male as well.
So what other conditions does come up besides the prostate? With men, this is now their organs, and they don't often, inform themselves of what's happening. Yeah. As women, when we have babies and, when the periods start, we start getting information. But as men, what should they know about their male organs?
Yeah. So then the other big area, obviously, is related to male sexual health, So things like issues regarding the penile area, erectile dysfunction is a big area. And then also infections or inflammation of the testicle, Okay. So again, in a younger age group, we're thinking of, patients that present with like lumps on their testes or sinister, if they feel something that's odd, which comes to the point about self-examination, which we'll touch on again later in the show. So things like infections, cancers of the testes, right down to the extreme of, trauma, injuries to the groin area, sports injuries amongst males, those kind of things one would see maybe relatively more common. Right. And then obviously the kidney issues, and the kidney issues, as Shoaib also touched on, regarding the overall health, So like, for example, Are they overweight? What's their blood pressure? That's a big thing as well. We were sort of briefly offline with chatting about the aging male, or
Yes.
sort of metabolic syndrome. Maybe
Yes.
we'll touch a bit more on that.
Okay.
Blood pressure, cholesterol, sugar, being overweight, and how that impacts the entire functioning. Because remember, the kidney is central to the production of urine. So if kidney issues, you've got problems with your kidney, that interferes with the function of the kidney. It ultimately impacts what's going to happen in the rest of the urinary tract also.
Yes.
And then the big area of kidney stones as well. Especially in the diabetic group, we see a relatively high incidence of kidney stones.
So definitely had to have a follow-up show on the kidneys. We will be chatting to Dr.
Absolutely.
Shuaib Wadi
Yeah.
a little bit later on, and he'll be giving us some advice as well as a specialist nephrologist, a kidney specialist. So definitely kidney information needs to be known,
Yes.
to men.
Absolutely.
But let's look at understanding the prostate and knowing when one should get a prostate exam to go and what would be the reason to be screened.
Yeah, sure, and that's a good question. A very topical thing, it's always in the media. It's always there. Like for example, you mentioned November.
Yeah.
I'm also involved in a screening day, with the Malaysia Cancer Society. So once a year, we have the laboratories donating or sponsoring X amount of blood tests for free for the community. So the prostate is very topical. The issue of screening, it's debatable in the literature and also across the, let's say, America and the Europe. So maybe there's some difference of opinion on how it should be done. But by and large, I think what we can agree on is that it's important to have some sort of baseline of the prostate. Now, if someone has a family history of prostate cancer, especially, in those families, maybe the siblings or other males in the family, we would advise that they have a check maybe early in life, like maybe from age 40, 45. At least a baseline check. They may not need to be seen every single year for their prostate, but at least they get seen once, they get a prostate assessment, they get a blood test, what we call the PSA, which basically is a disease marker. It tells us about the activity of the prostate. So that kind of gives us, where that male is operating. We have some idea about where they kind of sit. And then the specialist or the doctor that's seen that individual can infer, I need to see you again in 2 years or 3 years. What I do in my practice, after age 50, I tend to see my patient at least once a year. So we do a general assessment, like you mentioned, there's this overlap between urology and nephrology with regard to the kidney. So we sort of see more the surgical issues of the kidney. So when we see our patients, we do a full assessment, which includes an ultrasound, have a look at the kidney, the bladder, the prostate, examine the genital area, examine the prostate, do the blood test for the kidney, do the blood test for the prostate. So by the end of that assessment, we've kind of got a very holistic view of what the urological system is doing. And again, we're not seeing them in isolation, we're seeing them as an individual. So then we're mindful of their blood pressure, we're mindful of their sugar, we're mindful of their cholesterol. Like just last week, I saw a patient presented with a whole lot of, infections around the testicle, right? And I said to him, I think you're possibly diabetic, And we did a blood test on him, and there you go, never knew he's diabetic, never had it checked out before. And suddenly we're sitting now with a young guy, sugar's like over 20, 21, doesn't even know about it. He's living like his life is normal, So, you pick up these strange cases that come into play. But again, that points to the point of holistic approach to the patient,
And sort of bringing up the whole understanding of, which we want to look at, what are the possible signs and symptoms to look out for when you think, listen, I need to go and see my GP. I need to go for some screening. So one being the urination issue. The other being possible unusual presentations on the male organs, outside male organs.
So like how we advise females to do breast examination, right? Self-breast examination.
Which is very uncomfortable as well. So men has to do the same.
So I mean, we're not saying that basically they must do it every single day, but like, when you're in the shower, you sort of, your body. It's good to have an idea what the organs feel like. So if you feel something out of the ordinary, that would prompt you to say, I possibly need to have this thing checked out.
This doesn't look normal.
Exactly. As long as it
didn't look like this last month.
Something like that, or just to prompt you to say, I need to have this thing checked out. And nowadays, with the use of ultrasound, which is a non-invasive test, if you look at just testicles, for example, the use of an ultrasound for testicular examination, testicular assessment, the sensitivity to picking up pathology is over 95, 96%. It's a totally painless exercise. It takes a few minutes, It's not an expensive test.
So it's a mindset thing.
It's a mindset. It's about going there, The sad thing about it, is that, especially the younger individual, like I mentioned to you about things like cancers and stuff of the testes. Like a young guy sitting in his room, picks up a lump in the testicle. He's like, I can't talk to anybody about this. You know what? It'll go away. Do you know that understanding, right? So the parents are like, left out. He doesn't want to mention anything, you know. And we're hoping that this will also, these kind of programs will inform young males as well, you know, teenagers. 15 to 35 is specifically the group where the risk for malignancies are higher, you know.
Yes.
So again, you know, we're saying like just go and see a doctor, talk to somebody, you know. And it comes again, you know, to that whole your family environment, you know, approach to your children, how you're approaching them, what you're saying to them. Can they speak to you? Speak to a friend, speak to the gym instructor, speak to anybody, you know.
Yeah,
but
absolutely.
get some help.
Get that conversation going and start opening up. Like you said, don't hide it away.
Yeah.
We're going to take a short break. We'll continue the conversation on men's health. Yes, it's a very awkward topic to talk about, but at the end of the day, as moms, as parents, we need to encourage our youngsters to be comfortable with their bodies, and of course, in accordance to Islam and, you know, what is allowed, but also to know that this is a medical show. At the end of the day, we have to trust our doctors when, you know, that uncomfortable position does come up to go and visit them, and, you know, you were exposed. But inshallah, Allah knows best, and let it guide you, just that feeling. Go and speak to someone if something does come up. We'll continue this conversation on men's health in this month of November. More just after this. Stay with us. Assalamu alaikum wa rahmatullahi wa barakatuh. I'm Khawa Solomon. Stay with me as we chat about men's health, their wellness in a holistic way. We have in studio specialist urologist Dr. Salim Chinaro in studio with us, and we will be joined in online with the Dr. Shuaib Wadi, a kidney specialist nephrologist, and he'll be touching on a little bit of kidney information as well as a wellness message to all men. So just before the break, welcome back, Dr. Salim. Just before the break, we spoke about screening. We spoke about, you know, men being comfortable with, unfortunately, having to check themselves out from time to time. You've also mentioned the blood tests that, you know, at the end of the day, that's all they want and that's good enough for them. They don't really want to come in for the screening. But is that blood test enough to know what's going on with the body, with their physical body?
Yeah, I think that's a very important question. So just to quickly just touch on the blood test, it's something called PSA. Okay. So it's a blood test. It's a marker. PSA is a protein produced by the prostate. One thing we know about the PSA, it's only produced by the prostate. No other organ can do that. Okay. So we know it's very specific. It's gonna tell us about diseases about the prostate, right? Now, in a younger person that's going for, like we mentioned about someone just going to go for a screening test, you know, family history of cancer, for example, or they want to have a general assessment. In a younger age group, we can get away just with a blood test. But in my view, you know, one cannot only solely rely on that, simply because there can be changes to the prostate that occur sooner than when the blood test will reveal. So what's important for a male to have a full assessment includes also what we call the digital rectal examination. Unfortunately, it's probably the reason why men don't want to come and see the urologist. Okay. You know, it's a few seconds of a test, and with very valuable information.
Which feels like a lifetime.
Yeah, feels like a lifetime for an individual. But I mean, you know, it's literally a finger into the rectal area, and one can actually assess the prostate. So, you know, I always like to tell my patients, the standard is like the palm of your hand. Soft and smooth is what we want it to feel like. If it's hard, if it's bumpy, if it's nodular, those things raise suspicion that there could be an underlying malignancy, there could be an underlying cancer of the prostate. And we do sometimes see cases where the rectal examination is abnormal, but the blood test may still be sort of within a relative normal range. That may give you this false feeling that I'm okay. Do you know what I'm saying? So I think it's important to put the two together. It enhances the sensitivity of detecting the risk of a malignancy. Remember, the idea of screening is not just to make men come and do a blood test for fun. What we really want to sift out of that is those that are possibly at risk for prostate cancer. That's what the screen is all about. It's not just any condition of the prostate. It's specifically for that condition. So for that particular condition, the rectal examination is equally important because it's assessing the prostate for changes.
So going for a prostate screening, you have to just put your mind to it that you're going to have that rectal exam.
Yeah. And so, you know,
it's part of it.
Yeah, it's part of it. You know, I would say one, especially, you know, what we do at the National Cancer Society, because people only come for the blood test. We don't do a rectal exam at that point.
Okay, the venue.
But these are sort of younger people, or maybe people have come for their first time. The ones that have slightly abnormal blood tests, we refer them onwards for further assessment. And we watch them again the next year and we follow it up like that. So in a younger individual, we may get away with the blood test. It may just be enough for screening. We may sift them out because of the abnormality. But, you know, I say usually from age 50 onwards, there should be a general assessment, physical examination. If you've got a family history of prostate cancer, you should not just rely on the blood test. You should at least have by baseline, maybe one test in 5 years, even one test every third year. But at least once off, there's a rectal examination done at some point, you know, in that phase of checking, so that we know where your prostate sits. The other quick thing about the PSA, Hawa, is that other things can interfere with it. So, for example, like if a male has an infection in the prostate, what we call a prostatitis, it can falsely elevate the prostate. If someone went for a gastroscope or sort of colonoscopy, for example, some kind of procedure, it can falsely elevate the PSA. Just a big prostate can also falsely elevate the PSA. So your clinician, your doctor will, look at all the parameters. And then we have other aspects of the PSA, something like PSA velocity, free PSA, which help us to decide what the balance of probability for this patient is that they may have a cancer or not. Not just only looking at the one value specifically, So nowadays with technology, you can break up that PSA into so many different, what we call isoforms or aspects of the PSA, which help us build up a probability that does this patient have a risk for cancer, yes or no? Do we go a step further? That's the assessment. That's the summary of the assessment that's made.
And now we have Dr. Shuaib Wadi online with us, a nephrologist, a kidney specialist, to talk to us about men's wellness and health, because kidney issues does also come up when it comes to men. Assalamu alaikum to you, Dr. Wadi, and shukran so much for joining us.
Wa alaikum assalam wa rahmatullahi wa barakatuh, Khawa, and thank you for inviting me.
Jazakallah again for your time. I know it's a Monday morning, so very busy time for you in the surgery. But just quickly, on the whole, conversation that we are having with men's conditions, kidneys does come up. But overall, we would like a message from you, because men don't often think that they need to take care of themselves. But before we get to that message, just a question that has come in with regards to young individuals visiting and being seen for kidney failure. This individual, the question came in with regards to dialysis. Is this condition, kidney failure, related to heredity, to your genes? Is it anything to do with eating habits or stress?
So, statistically, kidney failure is still much more common in people who are older, over the age of like 50, 60, 70, and increases with age. And in general, the number of people ending up on dialysis is higher around the world. For a variety of reasons. The main one may be being that they're surviving their cardiovascular disease. So the patients are dying less of heart attacks and heart failure earlier on, and surviving longer and sort of outliving their kidneys, especially if they have severe chronic conditions like diabetes and hypertension. But you are right, there is a group of patients who end up with kidney failure at a younger age. And some of these are related to inflammatory conditions in the kidneys, like glomerulonephritis, lupus, those type of things. So lupus is much more common in females, but it does occur in males, and it tends to be more severe and lead to kidney failure in males compared to females. So that is a cause we're seeing more and more of. And then obviously there are genetic conditions like polycystic kidney disease and Alport syndrome and other conditions which affect males maybe disproportionately in terms of the decline of kidney function. So they end up on dialysis maybe at a younger age. So I think those are some of the reasons. We do also find that hypertension and diabetes may be starting at younger ages in men and women because of very poor diet and lifestyle issues, rapid weight gain in their 20s and 30s, a very salt diet, fast food, and so forth and so on.
So Dr. Wadi, I think with that in mind, what is your message to men when it comes to taking care of their kidneys and looking at their bodies and their health holistically?
So as you said earlier, many men sort of neglect their personal care because they're so busy looking after the family or working very hard and so forth and so on. And sometimes it's important to take some time and look at what health needs they have for themselves, so that they can remain healthy and be able to look after their families as well as look after themselves. So I think I'm sure you'll have some more information on this later through the show. Yeah. But hypertension is a big problem in our population and can start at an earlier age than used to. So I think if you're in your 30s, you should be having your blood pressure checked from time to time, your sugar checked from time to time. You should be paying close attention to your diet. Make sure that you reduce fast foods, that you reduce processed food. Okay. You have a healthy diet filled with organic food, fresh fruits and vegetables, And at the same time, you build in some exercise and physical activity into your lifestyle, because especially in young adults building up their careers and so forth, and they have young children between the ages of about 30 and 50 particularly, they often neglect their health. They're working very hard to build up their careers, to provide for their families, buy a house, all those types of things. So I think it's important not to take their eyes off the requirements that their body puts on them. The amanat that they have as a body needs to be protected as well. And then, I think that's an important aspect of maintaining their holistic health. Making sure that they look after themselves and they pay attention to their spiritual health. They pay attention to their psychological health, because it's often at that age, when they're still very young and they have lots of energy, that they sort of lose the plot. They think they're going to live forever.
Yeah.
I think we were all like that.
Yeah.
The other thing which we find in a lot of young people, which is much commoner now, is this sort of gym craze.
Okay.
So physical activity is good for you, but you can sort of do it in the wrong way. There is this aspect of building up your body for aesthetic reasons, to have massive muscles. And some of that doesn't actually have health benefits in the long term. In fact, it may be harmful in the long term, especially if you're using excessive supplements. Many of these people are using illegal steroids and drugs, which they get in the gym. So I think that's an important aspect which men need to take care of. And obviously, smoking is a big problem in both genders in our community, but it seems to be worse in men. And I think people need to be cognizant of what the harms are of smoking. And especially when you start at a young age, your body tolerates it, and you seem to be getting away with it, but you pay the price as you get older.
Very, very true. And words to heed from our kidney specialist, Dr. Shuaib Wadi. Shukran so much. Jazakallah khair for your time, Dr. Wadi. Until we speak again, assalamu alaikum and keep well.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
There we have it, nephrologist Dr. Shuaib Wadi giving his piece when it comes to men and looking after your health, kidney specialist. But stay with us. More with Dr. Salim Junara just after the short break. Stay with us. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back. A big thank you, shukr, to Dr. Shuaib Wadi for giving us some advice, a kidney specialist, and definitely we'll be taking that further because kidney stones does come in, some other age-related issues, both for men and women, but now we're focusing on men specifically in this men's health show in November. Welcome back, Dr. Salim. Before we chatted to Dr. Shuaib, there was this issue around age, but any comments you have with regards to what Dr. Shuaib mentioned?
Yeah, so the kidney is very, very central to the function of your entire urological system.
Yeah.
So the kidney is where the urine is being produced, and the rest of the urological system, or the pipes for the urine or the ureters, deliver that urine to the bladder. Okay. But everything happens in the kidney. It starts off there,
Starts there.
So kidney health is very important. He mentioned about blood pressure. He mentioned about smoking. Absolutely critical, we sort of touch on a concept called the metabolic syndrome, which encompasses blood pressure, sugar, cholesterol, and basically being overweight, or what we call body mass index, or waist circumference. So those four aspects, if we look at the concept of the aging male and metabolic syndrome, many, many people are faced with that exact situation, or may have aspects of the metabolic syndrome. And we know that predicts the significant risk for heart disease, heart attacks, strokes, etc. So, the shows like this, what we're trying to get across is that it's the holistic approach to the male. Yeah. It's not just focusing on the prostate, not just focusing on the bladder. We're saying this male is the breadwinner in most cases. We need to look after him, and this whole holistic approach is important. Yeah. And kidney health is central to that.
So just to touch on that with regards to the age with the screening, because now you're talking about waist circumference, and when you do the prostate exam, lo and behold, please realize that you're going to go for a rectal exam. But with that, does there then come the waist measurements? Are you taking the individual stress into cognizance when you do? What else is needed? Do they need to know with regards to the screening?
So I think when we say prostate screening, and we're talking specifically about the prostate now, so we're focusing just on that prostate issue, right? So we're doing a basic assessment, maybe just discussing general issues about their health. and we're looking at the blood test, and maybe we examine the prostate. But if I can just differentiate a little bit. For example, see, like screening is something that people go for. Like, let's say the Cancer Society is holding a screening day tomorrow. People go there and have a blood test done. They don't have a rectal exam at that time. That's not what I'm advocating. So let's then break it down to ages. If you've got a family history of cancer or prostate cancer, especially early cancers in your family, at least by age 40, between 40 and 45, you should have a baseline check at least. Let's say that. So you need at least a blood test. You don't have to necessarily have a rectal exam at that time, but you must have at least a blood test. But if there's a family history of prostate cancer, now your clinician will guide you. You may need to see them again after 1 year, 2 years, or 3 years, you know. But at least from age 50 onwards, you should at least be seeing your urologist or your specialist at least once a year for the full assessment, not just only the blood test. You know what I'm saying? You kind of sift out those patients. Remember, there's family history for cancer. You want to be more aware, more proactive. You don't want to leave things. You want to check early on.
Absolutely.
That's the focus of what we're trying to do, you know. Like, for example, with cervical cancer in females, with screening, we could eradicate the cancer or treat it very, very well. With prostate cancer, the disease of extremes, picked up early, the treatment outcomes are phenomenal. The cure rates are over 95%. It's an excellent outcomes. But picked up later, cancer that has spread to the bone, the advanced disease, very difficult to treat, you know. So the disease of extremes almost, if one thinks of it like that. Do you understand what I'm saying? And I think that's an important message to get across. The issue about the waist circumference, the blood pressure, cholesterol, that comes into more, it features more when we're dealing with men with, for example, with erectile dysfunction. Or guys come in just complain about just general unwellness, or they got some bladder issues, some prostate issues, and we do a whole full assessment of them. Then we'll take all of those things into account. But in a screening center, they may not necessarily measure your blood pressure and take your waist circumference and check your cholesterol and check your sugar. You know what I'm saying? It may just be for the prostate screening exclusively. But in our rooms, obviously, we apply a bit more of a holistic approach.
Brilliant. And like, who was the first to go and visit? Would it be your GP, or you think, listen, no, this is definitely some men's organ-related issues, and it does look kind of concerning. I'm going to rather find a good urologist. So what would you suggest?
So I think your GP is your first point of entry. You know, in some medical aid prompt you to see your GP first in any case. But by and large, I think your local doctor, someone close to you in your locality, you see them first, you know, if you have some issue. What happens is that, you know, sometimes people know specialists, or they know someone who's a specialist, or you may have treated some family member. So then they may bypass the whole general practitioner and come straight to see the urologist, you know. I think the point is that most people understand that I'll go see my GP first. I think most people have that understanding. Some people do come see the specialist first, you know, for their problems.
And what about the public sector? Do the clinics and their hospitals offer this this type of screening?
I wouldn't say, to my knowledge, I don't think it's something regularly done. You know, if you, for example, are given a referral letter by your GP to go to a urology outpatient clinic, you know, there's a process involved there. There's a long delay before you get an appointment, you know. But, you know, the point I was making about like things like our cancer societies, other NGOs, the IMA, many other organizations are providing at regular intervals, providing health screening, providing prostate cancer screening, providing breast awareness, providing cervical cancer screening, you know. So one should look out for those kind of things that help to maybe complement what maybe some deficiency in the public service, or augment what's in the private service, you know. So I think, you know, if you ask, if you speak about it, if you ask a question, if you got a problem and you go inside finding out, you'll find someone to assist you. There will be someone to assist you.
And just Google the Cancer Association.
You're going to find
Somebody
something.
will be there.
You're not going to be in isolation, that's for sure.
Let's talk about the bladder and some of the symptoms besides the urine issue, because there has been some questions that had come in, you know, having to urinate frequently. Why does it take so long? You've mentioned all of this to urinate. And as you get older, you wake up to urinate often. This is a sign, as this individual said, of diabetes, but you're not necessarily diabetic. So let's talk about the bladder, the functions, and what's happening.
So let's sort of tie up, let's say now the middle-aged guy, maybe sort of age 50, 55 onwards, prostate enlarging. So, you know, you think of it like a plumbing situation, you know. If you got a wider tube, water will flow faster. The narrower the diameter of the tube is, the slower the water will flow. So as men age, the prostate gets bigger in size. And what happens, it starts to narrow or occlude, or you know, it narrows the diameter of the outflow tract. So hence they have some issues urinating. That can be things like delayed to get started, spend a longer time in the toilet, you know, waiting towards the end, there's lots of drops of urine coming out, because there's a narrower space. And so the urine is coming out with a bit more difficulty, but more restrictive. Now, that ultimately does impact on the bladder. because now this narrowed area of the prostate or this narrowed area of the urethra by the enlarged prostate is putting a bit of strain on the bladder. So the bladder kind of becomes irritable. So you find you got a bit more frequency, maybe waking up a bit at night, bit of urgency. So that's how the two can get tied up.
Yeah.
But remember, we also, like I said, we're looking at the whole picture.
Yeah.
So diabetes, for example, was what came up. Yes, diabetics do wake up at night. They do have frequency. The example I cited to you about the young guy I saw in my rooms was even exactly that. Frequency, urgency, and waking up at night. I said to him, I think you've got diabetes.
Sure.
And that's exactly what he had. So we must be on the lookout for that.
And he was presenting with some stuff on his
with abscesses and infections and all kinds of things, right? So that must prompt one to say, okay, let me delve a bit further, okay? But also, we got to think about the bladder itself, Men generally do smoke, more common also among than females. And we know that smoking is a big risk factor for things like bladder cancer and also kidney cancers,
Sure.
So it's
Do you think it's just the lungs or the respiratory?
It's very interesting, and it's very well proven, Anyone that we see over the age of 40, let's say 45, that has irritative bladder symptoms, like as you mentioned now, frequency, urgency, waking up at night, and you're a smoker, that is a warning sign. You need to go check your bladder out.
And often they don't think that the vaping or the shisha pipes has any, because I mean, at the end of the day, that's still smoking.
Yeah, it's still a foreign substance entering your body, But then most of the studies have been done with tobacco.
Okay.
But I mean, we can infer other toxins that may enter your body, and it may have some effect on your global health,
So that being the only symptoms, the urination and the issues around there.
Yeah.
Other.
So it's like bladder pain. People complain about pain sort of below your navel area. That's usually where the bladder sits.
Yeah.
So discomfort or pain in that area, But by and large, like I said, those symptoms are very general. Frequency, urgency, waking up at night, difficulty urinating. When you see your doctor with those symptoms, we're going to go through a series of checks. We're going to check the urethra, we're going to check the prostate, and we're going to assess the bladder and the kidney. We're going to cover all those bases.
So that's physical and blood test.
Blood test, and also during the examination, we do an ultrasound, which is a very non-invasive test. As part of the examination, we do an ultrasound to visualize the kidneys, to visualize the bladder, and visualize some aspects of the prostate. So ultimately, the job of the clinician now, or the urologist or the doctor involved there, is to home in on what the potential cause is for those symptoms.
Those reasons,
You see what I'm saying? That's important.
So at the end of the day, with the urologist, it's like going to the gynae for a woman, and this is something that we as women are told, go and have yourself checked out from time to time. And women, for men, that's just not important. So what role, and I know this is now off a medical question, but what role do us as women, play in that?
Oh, very big role. If you mentioned about the talk I had with Mo as well, and I'm sure other specialists will agree to this. Often the wife is making the appointment, or the female in the equation there, say, no, my husband refused to come. I made the appointment. I brought him along to see the doctor, So that happens relatively common.
Really?
It's good. I don't think it's a bad thing, And the women are often right in their assessment of their situation.
I'm so glad you spoke about that outrightly, that it does happen. So if there is a woman out there that wants to make the phone call, please do that make that phone call to the specialist urologist to find out. Just, even if there isn't anything wrong, and I know the GP is the first port of call, but just go and have the men that you love in your home. They just don't even go with their 1 year physical exam. And when they have the flu, they're the biggest babies. But, it's important, men's health. And if it's going to take us as women to make that first move, let's do it. We continue men's health conversation in this month of November just after this with my guest, Dr. Salim Chunara. Don't go anywhere. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back in this Men's Health Movember show. Please do send your comments, questions and queries via our various social media platforms, because we want to know from you, if you do need a referral, do you need some more information, please get in contact with us so we can help you. And remember, the Islamic Medical Association of South Africa is a great way of connecting to find more information about your health. But now let's continue our conversation with Dr. Salim Chunara, urologist, specialist urologist, and also very impressed that you did a men's mental health show with Mo as well. So a holistic doctor in this respect. We appreciate it, and then affording us your time. Doctor, we want to look at, so we've dealt with some of the bladder issues with the urination, because that has come up with some of the questions. I want to touch on a bit of the prostate, but before we do that, I think let's look at the question around being proactive. So that has come up as well. Are there any measures that can, preventative measures that men can take place in their lives, and women as well, that can help them with before getting this issues, whether it is the bladder, the prostate, erectile dysfunction. How can they prevent it before it even happens?
And that also include kidney health in there. So I think 4 things are important if you want to be proactive about your health. One is because we know smoking is a big risk factor, as I mentioned to you. Bladder cancers, kidney cancers, and also smoking a big risk factor for erectile dysfunction. Diabetes, again, people uncontrolled diabetics, they have a high incidence of erectile dysfunction. They're also at risk for stones. They're also at risk for bladder issues. They're at risk for infections in the urinary system. So that's the second thing. So if you're smoking, quit smoking. Give it up. Sugar, if you have some of a diabetes, have yourself checked out. It's best to be treated so that at least it's under control. So you limit the complications, you limit the organ damage because of an uncontrolled high blood sugar. It's of no benefit to you to just leave it like that. The third thing is cholesterol. Looking after your cholesterol, your general health status, and obviously your weight. So again, it encompasses everything. And this advice is not just exclusive to urology. We're also now starting to recognize the role of obesity in the pathogenesis or in the development of things like cancers. And what's another big area in the urological system is kidney stones. And kidney stones is very much tied up to your diet, tied up to what your lifestyle is. We touched upon things like gout, your uric acid, uric acid stones, your being overweight, lack of water intake. All of these things are bad just for your kidney, but also put you at risk for stones, put you at risk for infections. So I think if you could do something, if we could summarize that point, is you need to live a good, healthy lifestyle. Eat well, exercise regularly, at least quit smoking if you smoke. Smoking is bad news, so quit smoking.
Dr. Shea brought up some muscle...
about the younger individuals in terms of
enhancing
gymming.
their muscles,
You're right, and that's the problem, especially some of these unregistered maybe gyms or people that just, maybe on the side, they're using sort of uncontrolled substances, or let's say these are not necessarily regulated, just to get a bigger body. And that puts strain on your heart, puts strain on your kidneys, and it affects your physiology because you're altering the dynamics of your physiology. You're interfering with the balance, So I think do it in a controlled way. There are ways one can do it in a very good way, in a safe way. But I think in everything it's about moderation, and equally well when it comes to trying to look like Schwarzenegger, or whatever you want to call it.
All right, let's look at blood pressure and gout. This is also a male condition that often comes up. And yes, urology is a big part of why men don't actually go out and do this. But there are conditions like men's blood pressure, their gout, kidney function. And there's also a question around men who present lower than normal sexual drive. Could you just encompass all of those conditions?
So when it comes to a low sexual drive, or often we ask men about the lack of a morning erection, for example, which is a which is a sign that may suggest that your testosterone levels are low. So low libido, low sexual drive, low energy levels, increased weight gain, difficulty to lose weight, may tie up what we call testosterone deficiency syndrome, something we tied up, we spoke about with the show with Mo, because it relates to testosterone deficiency. So we're recognizing that in men that have testosterone deficiency, if we replace the testosterone, we may actually help to overcome or assist with some of those deficiencies. Okay? So, there's lethargy, inactivity, typical, they tie around the waist, that kind of thing is just bad news, not only for their sexual function, but also bad news for, again, we mentioned about things like stones. Why? They're eating unhealthy, they're not exercising, so the cholesterol levels are high. They probably, the uric acid levels are probably also high because of their diet, or maybe abnormalities with their diet, lack of water intake, inactivity. So that ties up with your overall function. Remember, every part of your entire blood circulation filters through your kidney. Your kidney is that filter mechanism, and then whatever the body doesn't need is produced, obviously, as urine, which comes out. But if you're not looking after those minute microscopic filters in the kidney, which can be easily damaged by blood pressure, by diabetes, by cholesterol, it's going to have a ripple effect on other aspects of the urological system as well, and your overall health. You know what I'm saying? But I think what's important is that men that have sort of low libido and have tiredness, general malaise, it's important to also have their testosterone levels checked. I think that's another important message there. You know?
I know time's running up, Doc, and there are quite a few questions because I want to bring in the question around young boys and mothers actually worrying about them when it comes to their men's health issues and how they can encourage them to look after themselves, as well as a dad wants to know, does spending time with your children, given other responsibilities, does it help with the issues around male function? Because they say happy wife, happy life. So your wife's happy, the children's happy, your family's happy. Does that help enhance a man's, I don't know, their male function?
And we touched about some of this when we spoke about the mental health aspects, you know. Definitely, I mean, it would, no?
Okay.
Because you're providing your child with some kind of way to deal with situations. And they see in this family unit that exists, you know, that's, I wouldn't say idealistic, but it exists with harmony. You know, you're teaching them life skills. You spend time, you're speaking to them. You know what's happening in their lives. I think that's the family unit that is encouraged. It comes about by nature. You know, a husband and wife are together and they have a family, and that family unit needs to be looked after. You know, which I think has positive effects on how the child will grow up, what he will do in their lives, in his life. You know, with his family.
Absolutely,
Yeah,
and
so.
and I think you know, you have to approach men in this instance. When it comes to men's health, it has to be a holistic approach. It's not just them hiding away what's happening, the family, the mother, the father, the sister, everybody. And I think also understanding you know, the correct terminology, because you hide away, you say that thing or that. And even, you know, I've gone to a workshop where they say, you know, talk about the male organs, the female organs. Let children be comfortable to talk about it, when it's allowed, when it's not, you know, but just understanding, you know, what it is there and not hide the issue. So at the end of the day, Doc, I think, you know, we have to look at the way forward and sort of understand that men's health is important and it's linked to us as a family. And in Islam, it teaches us that, you know what, our medical professionals are the ones that know best. So if there is a question you have, pick up the phone, you know, make an appointment, and even if it is that mom, that female doing it. Dr. Salim, please give us your last words on this topic of men's health.
Yeah, so I think you said a very important thing there, that the approach to males has to be holistic. Yeah, we're not looking at males in isolation anymore.
Absolutely.
We want to look at every aspect of their health because they are the breadwinners. We want to say, look after your health. Like the point that Dr. Wari also made about that 30 to 50 group. You know, you are all over the place. You're trying to do so many things. You're trying to plan so many things. You know, you ignore yourself. But we say, no, just spend a bit of time for yourself. Because if you're not functional, you're going to alter the dynamics of your home. You know, so if I could just what I liked about the point was the holistic approach. That's it. It comes down to that point. That it's not just only about your prostate, only about your bladder, only about your kidney. We're saying we want to look at you holistically, in absolute totality. How you're functioning at home, how you function at work, what your energy levels like. Are you a smoker, not a smoker? What the whole thing. We're not just only focusing on
And it's
one
okay
aspect.
to be a baby if you're going to have that screening done, the uncomfortable rectal examination, and it's okay. Bring a partner, bring somebody that you're comfortable with, and I think, you know, like you say, holistic approach.
And the point about erectile dysfunction, just quickly, it's now understood to be a precursor for possibly heart disease. So men that come in and have erectile dysfunction, we send them also for a cardiac assessment because it's about blood flow. If you've got a problem with blood flow in the penile area, there may be issue on the heart. So, you know,
so all linked. We should get a cardiologist, a nephrologist, all of these specialist institutes. But a big shukran to you, Dr. Salim Junara. Always a pleasure chatting to you, and please do keep up the good work with the health screening that you are doing around. And if there's any more information, please do keep us knowing about it. That was Dr. Salim Junara, urologist, talking about men's health in this month of November. But before we do go away, know that the IMA does have regular screenings. So they are out at the Beckerstal IMA SA Clinic this Saturday, the 12th of November, 9 to 12 p.m. And that is in Modisa, Beckerstal, Westernaria. Also at Masjidur Rahman, that's where they're based, Masjidur Rahman in Beckerstal. And very important that you know about the various activities happening at the IMA and where they are, as Dr. Salim Junara mentioned, that, you know, they are one of the organizations that does these types of screening if you need them. So contact them and visit them via their website, that is IMA. Also volunteers, if you can help out at these various clinics, they always welcome your help. But also stay tuned to next week's show as we will be chatting to Dr. Raisa Abu Baker as she looks at women's health and the impacts of hormones. Yeah, we have our ups and downs, and if I happen to be screaming now, what's happening? And it could just be our hormones. We chat to Dr. Raisa Abu Baker in the next show. Stay with us on Health and Wellness, your Health and Wellness show. Next week, same time, same place from myself, Khawa Solomon. Wassalamu alaikum and goodbye for now.